Welcome to Face to Face. Our guest today is Dr. Sailaja Reddy. We are going to talk to her about coronavirus. There's a lot of information on traditional media, social media. Some is scary, some authentic, some non-authentic information about coronavirus. We are going to talk to Dr. Reddy about what exactly coronavirus is, how we can prevent it, how it works, and what are the remedies or things we can do through food, diet, and exercise to prevent and cure from coronavirus. This discussion is totally for the informational purposes, and if you have any symptoms or feel that you have a coronavirus or COVID-19, please do check with your doctor. Here, everything is just only for the informational purposes, and we want to cover almost each and every aspect of coronavirus. Saila, welcome to our studio again.
Thank you for inviting me again.
And no handshake today.
I know.
So there is a lot of information about coronavirus. You open a newspaper, go to any digital media channel.
Too much information.
Too much information. So let's first start with briefly, what is coronavirus?
The whole world is shocked with the pandemic of coronavirus, COVID-19. COVID-19 is a name given basically to the disease. It's a coronavirus 2019 disease. And the virus that gives is SARS-CoV-2. That's the name of the virus. And this is very different from flu and other viruses that we have because it is spreading very rapidly, and the important thing here is it is spreading when it is asymptomatic. So the flu usually spreads when it is symptomatic.
So when you say asymptomatic, what does it mean?
So before you get all the symptoms of the flu, right? So at least the peak period of shedding is in fact 2 days before you have the symptoms.
Okay. So when you get it, there is no symptom. You do not have any symptom.
No. You are spreading it even before you have the symptoms.
Okay.
And the other interesting thing about this virus, which is a novel virus, novel means nobody had encountered it before. This is a new virus. This is mutated from the previous viruses. So this is tricking our immune system. It's not only the primary damage that our body has from the virus, and it's in fact secondary damage you're having from your immune system. Your own immune system is attacking the normal cells. This virus is attacking the epithelial cells in the liver, basically the cilia of the epithelial cells, and it is dampening the immune system that regulates, which is called the T regulatory cells. It dampens that system, which means the immune system is not regulated well. So the other system is like going and killing the normal cells, which it is not supposed to kill.
So now, before we come to the immune, which we are going to spend a little bit time on that immunity, tell us how it is different from other viruses. Like, give me like flu and other viruses we have.
It's different in a way that I just mentioned because it has got pretty much all viruses have the same symptoms, but this one has more fever, shortness of breath, and dry cough. And,
but in the flu also we have the similar systems as well.
Yeah, flu has slightly different symptoms, but this one is more of a breathing trouble. Shortness of breath and dry cough are prominent. About 20% of the people do have like a nasal stuffiness, but which is not a prominent symptom in this viral condition.
Okay. So now let's come back to immunity. First, let's talk about what is immunity.
It is a defense system in our body. We have a structure and process. This is basically, I'm going to give an analogy, just like our military, which is protecting our homeland. This is the immune system in our body is the defense. It protects us from the invaders. There are like several mechanisms that we have set up by Mother Nature, like how to protect the body. So if you want me to explain, I can go in a little bit details on the immune system. I'm actually giving a very simple way of understanding. This is how, in fact, I understood also. Then later I came to know a lot.
So for a layman, that immune system is like, as you describe, like a military system which is protecting our body from foreign invasions.
Like, let me start a simple analogy. I'm trying to think how to put it in a simple way. So we all know that we have blood vessels in our body, right? So the minute blood vessels, they run all through the body. So these blood vessels have blood, which has got cells, white blood cells and red blood cells. There are many different kinds of white blood cells. These are produced from the bone marrow and they come to the blood. And each type of white blood cell has a different function in the body. So certain white blood cells, like, phagocytes, and they come out of the capillaries. And they go in the tissues. They look around and see what is going on. Is there any invader coming? This is like Marines in the military, because they go in the mud.
Military analogy is very
right.
apt. Yes.
They go in the mud and look for all the invaders there, right? So exactly that's what it is doing. Once it senses that there is something invading the body, so immediately it sends a signal to the tissue. The tissue releases substances called cytokines, which means it's preparing the body, the rest of the system, which is called the B cells and the T cells. That is inside, like the big system inside we have. So it is just preparing them. This basic phagocytes go and kill the small invaders. So 90% of the time they do a good job. Sometimes when the virus is very strong and it cannot kill it, or if our immune system is weak, then the signals go to the higher authorities, which is like Air Force. So the B cells send the missiles from there. So B cells call the shots. And this whole process is regulated by the T cells. One of the T cells is called T regulatory cells. This particular COVID virus is dampening the T regulatory cells. So it is not regulating the system properly.
It's amazing how smart our body is.
It's amazing, really. It's amazing when you look into it.
Now let's come back to the immunity now. So how does this body builds immunity? And how the immunity weakens in our body?
Okay. I could talk all day to explain about it, but again, I'm going to put it in a simple terms. It's not about building the immunity. You have to keep your immune system strong. It is not just that we are going to build it one day and let it go. You have to keep the immune system strong. That's why this COVID crisis is in fact teaching us a lesson that, you have to keep the immune system strong, because there are no pills or vaccines that work, because when you take the medications, it's going to target only that virus. This virus is known to mutate so quickly. So even if they find vaccine, it's going to mutate and give you the form that you cannot, the vaccine may not work. So you have to build the immune system strong. So keep the immune system strong. So what do you do to keep the immune system strong? Because you need to first look at the steps that's happening in your body. When the virus gets in, the virus basically, that it cannot survive outside. It needs an individual to go and multiply. It is such a tiny object. So it goes into your body. First, you have to help your body to stop the virus from penetrating your cell. Only when it penetrates your cell, it can multiply. Once it penetrates a cell, then you have to look into what you could do.
So I want to stop you first here. So let's first talk a little bit about stopping. So stopping you can do by social distancing and washing your hands and taking other precautions.
Spreading the disease.
Spreading the disease. So that's the one, step number one, right, to stop it.
Yeah.
And if I'm not able to do that, or somebody is not able to do that, what happens next?
Then the virus gets into your body. And basically, skin has a lot of protection, unless there is a broken skin or something. It goes to the mucous surfaces. Like, there's a lot of mucus. Mainly, the target is like a nasal lining. So when it gets into the mucous surface, it has to get inside the cell. So what you can stop from getting this virus going to the cells is, the reason I'm telling you all 4 steps is because
we want to know as much as possible.
Some nutrients work in all these 4 steps. Okay, some work in only one, but most of the nutrients, they help with each and every step. So when you think that you're exposed for sure, then of course you have to, what I personally do, I'm a physician, I'm still seeing patients in the clinic. And when I come home, of course, every day I take a good quality multivitamin, the professional grade multivitamins. And you want to make sure that your body doesn't have any deficiencies. If you have any deficiencies of nutrients or minerals, that is like an incubator for the virus. It can easily multiply. And there is another theory that I read online, was that in China, the selenium deficiency is very common. So if you look at any pandemic, like 3 or 4 pandemics we had, they all came from that area only. Because when the selenium mineral is deficient in your body, the virus can multiply very quickly in the cells.
So now,
so you don't want any deficiencies in your body. You want to keep your vitamins normal, and you want to check for the nutritional deficiencies. That's one thing. First, more than building it, what you want to do not to suppress the immune system. You have to.
So now I have billions of questions going on in my head now.
Okay.
So China is very close to India geographically. So you have this cilia deficiency in Chinese. What about among Indians?
Even in India, because there is a selenium deficiency, it's all coming from the soils, because the soils are depleted of a lot of minerals nowadays. So
Okay.
you need to take the vitamin supplements. There's an argument that these supplements work. Yes, they do work, because this is not the same food that we are eating that our great grandparents ate it.
Okay.
So you have to
So
take the
now
supplements.
you mentioned that you come and you take a full stock of vitamins. So for common people like us, how we can do that? What you will recommend for us?
But right now you don't have that many choices left, because they're all they don't have vitamins in many stores. But if you go to regular stores, they're not professional grade vitamins. To get the professional grade vitamins, you need to see a doctor. Usually, for example, in my case, I'm going to start a functional medicine clinic next month. I do have a dispensary on my website, so you can go and order the professional vitamins. And for the patients that come to see me, I usually recommend what are the exact vitamins that they need.
So for regular people, again, not a professional grade, but regular, what are the main vitamins we should be taking on
you have to take the regular multivitamin with minerals. You want to make sure it doesn't have any contaminants and stuff. And you have to take, during this season, the viral crisis season, actually vitamin A and vitamin D are very important. Vitamin D and vitamin A strengthen your immune system. You want to keep the vitamin D levels above 50 at least to protect your immune system.
Okay.
And vitamin A is also very important, because it stops the multiplication of the virus, and vitamin D helps with vitamin A absorption and how it works inside your body. So having these two vitamins is very important.
Okay. So now, we are at the stage number 2 for the virus comes and enters in your body, and then what happens?
And then to stop the virus from multiplying, there are like several things out there. The most important thing I think is zinc. Keeping your zinc levels normal, because a lot of people are deficient of zinc because of the same reason that I mentioned with the selenium also, because our body is using these minerals a lot when you're stressed out. When you don't have them that much in the diet, you have to give supplements to the body to be able to function normally. And another thing is, nowadays we tend to take too many pills also. Like, for example, antibiotics, any steroids, and all these things go and kill your good bacteria. So what happens is the bad bacteria dominates in your system. When you have so many bad bacteria, the 70% of your immune system lies in your gut, which means you are suppressing the immune system right there when there is no good bacteria there. Even like a stress is going to bring down the good bacterial number. So you need to take care of the good bacteria. And again, the omega-3 fatty acids, which are the fish oil capsules. So they're also important because of the processed food that we are eating nowadays. We are getting a lot of omega-6 in our body, but we want to keep omega-3s in our body like more than what we are getting now.
Okay. So now again, coming back to the corona, step 3. So you fail to stop that. It has entered your cells. And what is the third thing it is doing once
then once it gets into your cells, your immune system is already active. It is stimulated. So what happens is it sends, there is something called cytokines in our body, because the body sends the cytokines to produce inflammation. That's the way we are defending, we are helping our body, right? So with this, we are sending the cytokines that are pro-inflammatory. So the anti-inflammatory cytokines are not getting there. So that's why your lungs are destroyed. Then to help those systems, then there are like a lot of herbal remedies there. Like there's one herb called andrographis, and that's there were some studies done on the virus. It helps, and there is another herb called NAC. It is N-acetylcysteine, which is actually given for the people who have the Tylenol and acetaminophen poisoning, that actually helps, with the virus when it multiplies. Once the virus multiplies, our own immune system is going to take care of it. That's why you need to keep it strong more than giving some herbs. Like, you need to, in our Indian diet, we are fortunate that we use a lot of natural herbs. Like one of them is like turmeric, thyme, like cilantro. And all these are antiviral herbs. We are kind of blessed to be able to use them regularly in our diet, except that, we cook them a lot, which I don't do it personally.
Well, we are going to talk a little bit in much more in depth later on in this talk. But again, I want to come back to the coronavirus. So it has gone into our system. It has infected our body, and we are sick. And of course, vast majority of the people are surviving the sickness, and they are coming out. So what happens after that? After you fall sick and you are lucky enough to recover and come back, what you should be doing then?
So then you used up a lot of resources in your body. What you need to do, which we don't, we're thinking more in terms of what I should eat, what I should supplement in our body. Now I'm going to talk something different.
Okay.
So what you should not do is also the topic that we have to discuss.
Absolutely.
So eating sugary foods, the high carbohydrate diet, that itself suppresses your immune system. So by not eating the sugars, by not eating too many grains, you're strengthening your immune system. In our community, everything is a sugar. I went for the shopping. I was looking at all this processed food in the middle of the aisles, and it is all gone. Then I came to the produce section. The produce section is full. Nobody touched it, seems like. So that itself tells me that when you have a virus, when you're sitting at home, you want to protect your immune system, you want to eat good food. You want to go out, eat some fresh vegetables, especially like cruciferous vegetables, which is like a broccoli, asparagus, cabbage,
by the way,
cauliflower.
Broccoli is my favorite food. I just love broccoli. Yes.
That's good. Maybe that's how you're protecting yourself.
I can eat broccoli for breakfast, for lunch, and dinner. And there is hardly, at least one diet is full of broccoli. Just go and just little steam, put a little bit salt and pepper, and then I'm done with that. Broccoli is really my favorite food.
Right. And there is the other thing that people may not be aware of is like a inflammatory diet. There are certain things that we eat in our diet are inflammation producing. So you want to eat less of those things. So I'll give you the list of what gives you the inflammation.
Okay, let's first start with what we should try to avoid in eating.
Okay. This is what, that is, this is the topic, the inflammation producing foods that you have to avoid.
Okay.
There are like 5 things that I would say everybody should eat less now that we are going through this crisis.
Okay.
The gluten containing foods. The gluten creates inflammation. It is not just for the people who have celiac disease, who have gluten allergy. In general, for everybody also, gluten produces more inflammation, and the dairy products give you more inflammation. And genetically modified foods, like most of the corn
So give me an example of gluten food, like what will fall in
the gluten containing food is mainly the wheat. Wheat, rye, and barley, because the wheat is the main thing. It is not just the wheat, but it is there in a lot of foods as a preservative also. So you need to see the labels to see. And like wheat, like it includes all-purpose flour, like all the cookies, pastries, they're all gluten. Bread, pasta. So you need to avoid those foods.
Okay, so the gluten is one.
Gluten is one. For one reason, it is inflammatory food. Another reason, it is a lot of sugar. For both reasons, you have to avoid it. And I would say like dairy products also is not a great option here unless you're looking into fermented dairy, which is milk or kefir. It is okay because it's
yogurt.
Yeah, yogurt. But if you are seriously dairy intolerant, then you should avoid even yogurt. But for just general public, I would say if you don't have any symptoms with the dairy, you can still take yogurt. And there is another type of yogurt called kefir. It has got a lot more good bacteria than the yogurt, so which personally I make at home. And then corn, soy products, eggs, these are all inflammation producing foods. So if you limit these foods, you're kind of, taking care of your immune system.
So you said the eggs also, you mentioned eggs too.
It's a lot of people. This is in general, not that everybody will show the reaction, but your body sees it. Any food that you eat, not just the foods that I mentioned, any food that you eat, it creates some inflammation in our body. That's why we're talking about the time restricted eating also. We don't want to keep eating all day. Personally, I don't eat one day in a week. So when you give a gap like that, your body has time to recuperate. And
So now coming back to what are the foods we should be really eating, should be in our daily diet? Broccoli, you mentioned one.
the foods that you should focus on are the good quality proteins. The good quality proteins are like I usually prefer to have the vegetarian proteins, which are like lentils. Even among the lentils, small size lentils are my choice. If you really want to go in details about it, like
Yeah, let's talk about that because we really want to educate our audience to this. They can,
okay.
Yes.
I'm just telling you what I eat. Actually,
Sure.
there could be a lot of other good things.
Okay, let's talk about what you know.
So I eat something called French lentils. That's my favorite of all the lentils because I can easily find the organic lentils in French lentils, and they're very easy to sprout. I eat all my lentils after sprouting only. They're very easy to sprout, and they're very delicious. First of all. They're not widely available in the Indian stores. It's you have to go to a health food store to get the French lentils. Then when you come to other lentils, I like mung beans. Then I go with small mung beans come in different varieties, right? Brown mung beans also there. The other ones are like chori, like a small ones. Then chickpeas, it's chenna, right?
Chana, yes.
Chenna, I would say the small green chenna is best because you can sprout it very easily. Actually, you can eat it as a snack by itself, or you can put it in
But
any
what about
salads.
like we have many dishes made of chana, grind it and have. What about those dishes? Are they still better than eating wheat, or they're?
Oh, they're definitely better than eating. Wheat is actually a grain. Chana is like a lentil. It's a protein. So they both are slightly different. So when it comes to eating the grains, they have some bad things too. Like they contain a lot of lectins and things. So to take the bad stuff out of the lentils, first of all, you have to soak them. Then you have to sprout them. Some people, like in Japan, they have like a fermented lentils also. So which, of course, I don't do that. I usually soak and sprout them, and if it is a large lentil, then I steam it a little bit. So we are talking about the herbs now. They're very good, like cilantro and garlic and all these things, right? So you can just season it. Onions are good too because they're onions, garlic, they're all called prebiotic food, artichokes, onions, garlic, which means they feed the good bacteria in your gut. When you eat this prebiotic food, you're just multiplying the good bacteria. Then are we done with the lentils? I think.
Okay. So now I'm again coming back to the Indian diet because we Indians have a very strong taste for the spicy food, and we have from childhood till that's what we have eaten, so that's what we know, and it is difficult to change those the taste and those food habits.
Actually, it's not difficult, I would say, because what Indian diet is good in a way, but we need to watch the carbs. We eat a lot of sweets in our diet, so we have to cut down on the sweets, and we eat a lot of rice, roti. So they're not good. There's too much carbs in there. So if you can control that, and if you don't overcook the Indian diet, again we have a lot of deep fried foods in the Indian diet.
Yes, yes.
So you can't generalize the Indian diet. What you're cooking in the Indian diet is important. And our ancestors, like our great grandparents in Indian diet had a lot of probiotic food. Nowadays, people don't eat at all.
Okay. Okay, I'm going to just name some Indian food, which is I think we eat every day, at least in my household, and many other friends I know. And you just tell me what is good and bad with you.
For example, you said broccoli, right?
Broccoli, again, that's my favorite, yes.
And then I'm coming to how to cook the broccoli also. Broccoli doesn't mean if you go and deep fry the broccoli or cook it for a long period, it's not giving you the same benefit.
Yeah.
The broccoli contains an enzyme called myrosinase. So you need to release that enzyme, right? Just to release the enzyme, all you have to do is steam it for 2 minutes. And then if you cook it for longer time, you're losing a lot of nutrients in broccoli.
Sure.
You just have to steam the broccoli for 2 minutes, and it overcooks even after you take it out. So it's better to put it in a freezer or dip it in ice cold water. That way you're not overcooking it.
Okay.
That's how actually some restaurants make the broccoli, and that's the only way my kids eat the broccoli.
Sure.
So
now I'm going to just give you throw out some Indian food. What about potato, which is very common in Indian?
Yes, potato. I don't like it at all because it's too much sugar, too much carbs in potato. So once in a while it's okay, but you don't want that as a staple.
What about peas?
Peas are good, and like you said, peas, right?
Yes.
Peas are good. Again, it depends how you're eating it. If you just take the frozen peas, they're still good. But best way of eating the peas is to get the dried peas and soak them in water overnight and sprout them and steam them a little bit and then use it in salads or in any dish that you make. Even in broccoli, I put some peas in there just to have some protein. Cauliflower is excellent, but not in a form like gobi Manchuria because you're deep frying the cauliflower there. So you can eat lightly steaming is fine, but cauliflower you can eat it raw. It's there in the salad. So make sure you get the organic cauliflower.
What about carrots?
Carrots are very good. Again, carrots have a little more sugar. I usually put carrots with some other stuff, but they are much better than any processed food.
What about samosa?
In
North India, it is very common.
I'm not a big fan of samosa for several reasons. Because it is deep fried, it has got a lot of gluten in it, and inside the samosa, there's a lot of potato in it. So for several reasons, I stay away from samosa.
And pakoda?
Same thing. It's a deep fried. You're asking me all deep fried foods.
Well, because that's what we eat, and now I know that how bad, except broccoli, we have a terrible diet habit, and I see the same thing being cooked at friend's house as well. So.
No deep fried foods in this season, especially. Once in a while is okay, but we do it a lot.
And also you are totally against rice and chapati.
And the most important thing I want everybody to adopt in our Indian diet is cabbage. Cabbage is loaded with nutrients. So how you're getting the cabbage inside your system matters, because when you take a cabbage and cut it and eat it, you may not be absorbing the nutrients in the cabbage the same way that you would absorb when you are fermenting a cabbage. There's a way, it's such an easy way, and it's called sauerkraut. So when you eat the sauerkraut, you are getting a lot of nutrients from the cabbage. You're getting the good bacteria because it's loaded with good bacteria, and it has got some acids and vitamin C, which helps with the digestion of the other nutrients. Like if you eat a protein containing meal, right? We want a little more acid and enzymes in your system. This is stimulating those things for the good digestion.
I also want to touch on the fruits. What are the good fruits and what are the fruits to avoid?
Okay. I personally avoid the fruits that have got more pesticides and more sugars in it, which are grapes. I don't eat that many grapes because too many pesticides in the grapes and too much sugar. The best fruits to eat are berries, actually, organic blueberries, blackberries, strawberries, because they have more pesticides. That's why you need to choose organic berries. And the kiwi fruit is also good if you go to organic
Mangoes
kiwi.
don't have pesticides.
Mangoes do have pesticides.
Really? Well, in my village, we grew.
Oh, in village is different story. But here, if you buy it in the stores, you do. But mangoes are lot of sugar, but anything, it's if you eat in limits. Banana is not my favorite fruit because it is all genetically modified banana. I was in fact going to write an article on my blog about the bananas. The bananas you get here are not the same bananas that we used to eat back home, because it is almost like all the banana that I see here is genetically modified. Very few bananas are organic and non-GMO.
Now, before we come to exercise part, I also wanted to touch base with you on the spices. So you said the haldi,
yes, turmeric. Turmeric is.
What about some other spices in Indian cooking?
Every spice has its own benefits. Like turmeric is a common spice that we're using. So we talk a lot about turmeric. I wanted to say a little bit about the detoxification. Okay, there's a phase 1 and phase 2 detoxification. The turmeric helps in every step of detoxification. That's how good it is. Again, the way we cook in our diet, it's like we put it in the seasoning. It's not doing any good when you do that.
Yeah, put it in
So,
sabji, a frying sabji and put it there.
right, you have to get the turmeric in the curry, like before you take it out or something. You don't want to fry the turmeric too much because it's such a good thing for your body. Or take the curcumin capsules. They're very good for the body. Personally, when I have cold, what I do is, even otherwise now I'm taking it every day. I put a little bit of turmeric and a small amount of bell pepper and a little bit of olive oil to mix it. Olive oil, or you can put ghee and take it. Take
Oh, the
about a
ghee, another one
tablespoon.
I wanted to ask you. So I'm glad you mentioned ghee. So how healthy or unhealthy ghee is?
Ghee,
And how much?
there's no straightforward answer for that. I'll tell you why. Because ghee has saturated fats, right? The reason it is good is because it is soothing to your gut lining, and your body needs saturated fat also, because there's a lot of things work on fat, because your hormones, your cell membranes, you want to keep the cell membranes fluid for the nutrients to get in and the toxins to go out. So you need fat in your body. So if you want to get fat in a good way, it is ghee. I am not totally against the ghee, actually. It is good for you. But again, if you're eating biryani and you want to cook it with the ghee, and you're getting a lot of bad stuffs already in foods like that, like meat and deep fried food, then you have to limit the ghee. If you are a person who is eating a lot of vegetables and good stuff, then you want to eat ghee, because you need the fatty acids inside your body to function.
Now, this is one spice which is very dear to me, black pepper. And I have one story to tell you that I remember since I was, 5, 6 year old. My job was to, every day in the morning, my grandfather will finish brushing his teeth. His first thing he will eat will be black pepper, about 4 or 5 seeds, and a little bit salt every day. And I will take him with a glass of water. And that also I formed the habit too. So now, still today, no matter where I am, my first thing I take is, after brushing my teeth, is few grains of black pepper and few grains of salt.
Right.
So I have always been curious about the black pepper.
Black pepper is actually a good spice to take because it helps with absorption of some other herbs also with it. That's the reason we take it with turmeric. Even if a lot of curcumin supplements have black pepper in them for the absorption. But the only drawback is some people have allergy to black pepper. When they take it, they complain of tingling sensation in the lips, like that. So you got to watch out. You got to watch out for that.
Okay. So now, after all this food and everything, let's come back to exercise. How exercise plays a role in maintaining the immune system?
My favorite exercise is yoga. Like when our ancestors beautifully designed yoga, because the lymphatic system in our body is a drainage system, basically.
So what is the lymphatic system?
Lymphatic system is like the whatever toxins the body creates and kills our own cells also, but the dead cells need to be taken out. And this is basically a drainage system in our body. So the drainage system need to move, right? Otherwise it gets clogged. So if you just sit in a couch, for example, you're not moving the drainage system. You have to move the body somehow or the other. But yoga is designed in such a way that it moves the toxins out of your body. Not only by the lymphatics, even from the breathing, the mind also, the thoughts in your mind. That's another thing I was going to mention. It's not just the food. Even the bad thoughts that we have in our body is very stressful to your immune system. You got that's this time of the year, we have to think about thinking positively. People are too stressed out, watching too much TV. We have to give a media break because that too much of the sensationalized news on the TVs is not good. That's creating a lot of stress, and the stress indirectly gives you the inflammation and weakens your immune system. This is not the time to watch too much TV. There are you have to just look at the reliable websites like CDC and World Health Organization website to keep yourself up to date, which is important, but not watching too much of the media.
So let's come back to you're talking about the yoga. So you do yoga, and yoga is okay.
Yes, I do yoga. It's a muscle strengthening exercise, and it calms your mind. It's good for detoxifying. You need to put the cardio, those things also, but you have to do something like yoga too every day. So you have to mix exercises. You have to do the cardio, and you got to do the resistance exercises, and you got to do high intensity exercise at least for 5 to 10 minutes in a day. And mind exercises are very important. The mind blocking exercises to keep yourself calm. There are so many apps out there, which I'm going to put on a webinar that I'm doing next week. So I'll put all the apps that I would recommend. Some of them are like Calm. This is Headspace, Insight Timer. All these are good apps to go and just keep yourself calm. And each person has their own way of keeping themselves calm, like prayers or deep breathing exercises. But you have to do something. You have to be consistent. Every day you need to do it.
So now, as we come towards the end of the interview, what are your last words on coronavirus and everything else we talked today?
So don't get too excited and stay calm and cut down the sugary foods. Just because now everybody has time to cook, just eat some healthy food and teach your kids. This is the time to tell the kids that, you got to eat healthy, because we are helpless now. We don't have a vaccine, we don't have any drugs. All we can do is keep our immune system strong so that the virus won't come and hit you. Even if it does, it goes away quickly. So don't eat sugary foods and take multivitamins and other vitamin A, D, omega-3s. If you take nutraceuticals, they work in a different pathway. So you have to take, it looks like you're taking too many, but it is necessary for the body. If you just take it as a drug, it goes and works directly to that particular bacteria, that particular virus. So you just take one. But a lot of people say, oh, you're taking too many supplements. Yes, you have to take it because they are working in so many physiological pathways. So,
well, one last one. Is there anything positive which can come out of coronavirus?
Oh, yes, I think there is. It's teaching us how our immune system is weak and how important it is for us to keep the immune system strong, how we need to keep ourselves calm. You have to do the mind blocking exercises when you're home. You know how important it is to protect ourselves from this environment. This is just one virus. There could be many other viruses that can come. When you take the nutraceuticals, when you keep yourself healthy, not just coronavirus, you are keeping yourself away from many other viruses that could be coming.
Sailaja, thank you so much. And I think very soon we'll be talking again with you about your upcoming new business you are starting.
Yes.
And looking forward to that, and all the best with that venture as well.
Thank you so much.
Thank you. Sure.